अस्सलाम वालेकुम। मेरा नाम आई एम प्रोफेसर बिखा राम देवराजानी, प्रोफेसर ऑफ मेडिसिन, वाइस प्रेसिडेंट ऑफ द पाकिस्तान सोसाइटी ऑफ इंटरनल मेडिसिन सिंध चैप्टर, and presently I am working as a vice chancellor of Liaquat University of Medical and Health Sciences, Jamshedpur. As you know that there is the pandemic of the coronavirus throughout the globe. Out of 193 countries has been suffered. We Pakistani people are also under the threat, and in all the provinces of the Pakistan, there is a coronavirus cases. There is so let us discuss what are these. So now you everybody know the coronavirus make a large family of viruses that are responsible for the outbreak throughout the world. And previously the MERS, SARS, and they all were they and this one COVID-19, they belong to same family. And this outbreak of the COVID-19 is a outbreak was in China first in December in the city of the Wuhan, and many countries have now detected the virus in travelers. Some people who were in contact with these travelers were infected by them. Although there is a lot we don't know yet about this new virus, we can still prevent the disease and stop the outbreak. How it spreads, we must know how it is spread. Most of the people, they are being infected from other people. It is probably spread through droplet and are created when we talk, cough, or sneeze. The touching contaminated object puts the droplet onto your hands. If you touch your face with the droplet can enter into your nose, eyes, and mouth. So avoid to touch your hand to your face without washing. Now, what are the symptoms? The common symptoms, just like as the flu, the fever, sore throat, cough, shortness of breath, muscle aches, and some of the patient is in a diarrhea. Some of the patient having the diarrhea, and these symptoms are similar to those tested or need to tests are needed to make a diagnosis by throat swab and blood test. And this is these symptoms may appear at any time from 2 to 14 days, and these symptoms may be mild. In most of the patients, these are the mild symptoms and can be treated with a medicine to lower the fever, relief pain. For example, don't use the NSAIDs. Use the paracetamol. You don't use the NSAIDs, non-steroidal anti-inflammatory, because they can create the problem. If the symptoms are more severe, then treatment in hospital is required. But most of the patient having the mild symptoms, so we can treat them easier. And ask the patient to have a paracetamol, or they eat lot of the fruits, lot of the vegetables, and they should drink the lot of the water. If the symptoms are more severe, then treatment in hospital is required. Now, maintain good personal hygiene. This is very important. How to prevent yourself and your patients from the COVID-19? That maintain personal hygiene. Wash your hand frequently with soap and water, or use alcohol-based and hand sanitizer when soap and water are not readily available. Ideally, you should wash your hand with the soap and water. If it is not available, then you can use the alcohol-based hand sanitizer with soap and water that are not that are water are not, where water is not present. Now we will tell you how to wash your hands. We will tell you. I will perform. We will perform this hands on. That you can see this. Cover your cough and sneeze. Cover your cough and sneeze, and use. For example, anybody who is taking the cough or a person who is sneezing, then use the tissue paper and use the tissue paper, and don't cough or don't sneeze without covering your face, because by doing this you can spread the virus in other person which is near to you, or you can infect the articles beside you, for example table, for example chair, for example any door. So cover your face with the tissue paper and sneeze and cough in this tissue paper. But in some time, when tissue papers are not available in your pocket, and then what you have to do? Then you try to cough or sneeze, you try to cough or sneeze in your in front of in the elbow, in bended elbow. And with your cough, then this will not spread so. But this is this is only you can do when there is no tissue paper. Now, now avoid to touch your face, eyes, nose, and mouth. This is very important, because the route of the entry of this virus is through the nose, through the mouth, and through the eyes, and so if you touch anything to your face, then this can go to, inside. And you know this virus is causing the respiratory symptoms. So this so keep away from the people who are sick. Let them to cough or sneeze, and don't let them to cough or sneeze on you. If somebody is coughing or sneezing, then and guide them and ask them that please cover your mouth, and you should sneeze in another direction, not towards you. Avoid activity which expose you to large group of people. For example, there are many people, they are over there, avoid to go that place. And please keep the distancing. That distancing should be at least you see the 1 meter, or 4 feet. So keep the distancing. By keeping this distancing, it has been seen that there is no spirit of, there's less chances of spirit of virus disease. Avoid handshaking, kissing, hugging. Why? Because anybody who is infected, and he or she is using his hand most of the time. Right-handed people, they always use their right hand to the nose, to the face, to the mouth. So please don't shake the hand, and by this you cannot be infected from that person. Kissing or hugging. Suppose I am talking, I am sneezing, I am coughing. If my saliva, my secretions, they will be on my clothes. In fact, if you will hug to me, then your clothes will be contaminated. And if you put your hand over your clothes, then naturally when you put your same hand to your face, then you will be diseased. So, so do avoid these things. Culturally appropriate gesture to visitor: maintain distance at least 1 meter, at least 1 meter. And when you go in public area, much possible you can keep your distance 1 meter to 2 meter. So if there's a space, and if you keep this distance, then there's a less chance to be transmit of this virus from one virus to one person to other person. Now, after travel to an affected area, monitor your health. Seek medical attention if you develop symptom, following the local procedure for your location. When traveling to medical care, consider wearing a mask. Suppose any person who's traveling, who's having their doubt that I have got some coronavirus, a suspected case or something else, then that should travel from that area to another area, not in public transport, not in groups. They should travel in their own vehicle, yeah, private transport, and the distance and do not try to be a 2 to 3 person in a car or that in a vehicle, but in between sitting there should be the distance of 1 meter at least. And the person who is suspected case of corona, that must have a mask on the face. Otherwise Otherwise, he can transmit the disease to the driver or the person which is sitting in the car. Ensure you provide your travel history to the medical facility. You should. Here, I want to clear two things with the symptoms. Here, I want to highlight the two things. There is because there is the public, there is the fear. So we should define what is the confirmed corona case, what is the suspected corona case. So any person who is the travel history of 14 days from the area where corona is there, coronavirus disease is there, and if within the 14 days the travel history, then are the person who remained with the known case of coronavirus in our Pakistan, for example, in a hospital setting, or any person who's visited outside and who has been made, who went to his or her own house, and any person which remained close contact to him or her is the suspected case. And when the suspected case is within 14 days, not 40 days, or suppose many people say, I returned from USA, UK 50 days back, so the symptoms they usually appear within 14 days. If the 14 days has passed, then there is lesser chances of to make the patient that suspected case of coronavirus. But within the history of travel of 14 days or contact with the coronavirus patient within the 14 days, then we will call these patients as a suspected case of coronavirus. And in the suspected cases, then we will advise the investigation. The ideal investigation is the PCR, and so I will tell you more in my presentation. So this is regarding the definition of confirmed corona patient and the suspected corona patient. So this is the definition. Screening and contact tracing, it is very important. It's important to stop the spread of virus. Yes, screening may be done at entry point to detect the sick patient. Suppose one patient is coming to your clinic, one patient is coming to the hospital. If that is a suspected case, then don't mix that patient with the other indoor patients, or there are many people. And then there should be there you should make some fever clinic or corona clinics separate, and that patient should be that should that ask, one should take the history and screen the patient over there, and also take the blood test over there. These contracts may be asked, some contracts they may be asked, because this is humanly in our health delivery system in our country, it's not possible to make every people to quarantine in a hospital or in government setup. Then ask that person that please stay at your home for 14 days, don't infect the other people. If any patient is suspected and in a house, in your home, if there is a separate bedroom with attached washroom, and you should make all your things separate, and you don't move out of that room, you should stay in your room. Please don't infect your other family members, and to monitor your health for 14 days in case may develop the symptoms. If suppose in within 14 days, if any person who develops the symptom, then so so this is regarding the how to self home quarantine. At this juncture, government has taken the quarantine of a whole nation. So please convey this message clearly convey this message clearly to your patients, to your families, your neighbor, the people to whom you love, or the people they love to you, that please stay at your home, because we all doctors are sitting in the hospital. For them, we are sacrificing our things, our own, in the by sitting in the hospital, to by with we have got a maximum exposure in the hospital. So we have to make our own protective measures, doctors and paramedics. So we will show you how we can do this. So personal protective equipment for novel coronavirus is very important. CDC requires strict standard adherence to standard airborne and contact precaution plus eye protection for the care of patient with under investigation for coronavirus. So this is very important message. And now, now, how to how to make your hands, how to wash your hands. This is for everyone, doctor, the patients, whole nation. So how we will do this? Then gowning and prior to donning, all these things. Our my one of the technologist, he will do it practically over there. Then you should look him. So I'm over to my technologist now. He will tell you, because if you are if you are wearing the gown, you have protective kit that contains the gown, shoe cover, head cover, nose cover, that is the N95 mask for the people, for medical personnel, and then the hand gloves and the goggle. All these should be weared in a proper way. And when you are disposing of it after completing your job, then this is very important step. Most of the people, they don't know to how to take off these gowns and these all other things. So there are many steps we will discuss theoretically later on. But at present, let us see how how one person should prepare to wear the whole personal protective kit. So please come over here and show them. Please wash your hand first. Now please look carefully. Please look carefully. Please look carefully. And he has already washed his hands. I will tell you again at the end that how to wash your hands. He has washed his hand. Now, now he has taken the uh,
Sanitizer.
so he is using the sanitizer over the hand gloves, because some of the time these are hand gloves are not sterilized. When they are not sterilized, then we don't know. So after wearing the hand gloves, you should use the sanitizer. Look in the method. First, he is rubbing in this way, then he is rubbing in between the fingers, then he is closing, he is washing his under the thumbs, and then from behind. Now he is ready to wear the gown and other things. Please wear the gown. So next step is to wear the gown. So the gown should be of Taix made gown, because this gown has got two layers, one layer inner side, one layer outer side. This is the real gown, not surgical gown. So this is the real gown. So this gown is very, because these two layers. If suppose you have got a sweating, your sweat can go out. But if patient is coughing or sneezing, that secretion will not go inside this gown. So this is Taix gown. This is the Taix gown, which is important. So please wear the gown. So look on him. First of all, he has to wear the gown from the from down, from legs. So he is wearing the gown from the legs. Then he will take the gown to up, and then look on him how he is wearing the gown. Now he has put in the arms inside the gown. Then when putting the arms inside the gown, then you should have a head cap. You can have a the now he is completely is safe up to this place. Now what next to do? Please go do this step, and then wear the mask. Please, this is very important. Our people, they doesn't know how to wear the mask. Keep your mask in the right hand. Look on him how he is doing. Keep the mask in the right hand, fix it on your face, including the bridge of the nose. Then with the left hand, you tie your you fix your mask. This is the N95. Now this is totally fixed over his nose and face. No anything can go inside from this mask. So this is N95 mask. This is not a surgical mask. Okay. After wearing the mask, then what to do? The next is wear the wear the this eyeglasses. You see this this is goggle or eyeglasses. Yeah, he has wear these eye cover plastic this thing. Now now what you have to do? Now he is going to put the head cap, which is already in the part of gown. Now he is now he is wearing another gloves, because the first gloves which he has wear, because these gowns, these things were not sterilized, and so he is wearing another gloves. So now this is double gloves. If the if you have got a latex gloves, then okay, one is okay. But if this is the common surgical gloves we cannot wear when we are dealing with a patient. Now this is the dressing. This dress should be for four people: the doctor, which is dealing with the directly dealing with the coronavirus patient, and the nurse, which is dealing with the coronavirus patient, and the ward attendant, which is present inside the room. For that is important. The sanitary worker, which will work to clean the isolation ward or quarantine ward, isolation ward, they should have this wear this they hold this dress. Now he is safe to deal with the coronavirus patient. Now another important thing I want to share with you, that is the how to remove these things. So this is very important. When you are removing these equipment, the personal protective equipment, you can infect yourself, because now you have dealt with the patient. So on your gown, on your nasal mask outside, on your gown, all these things will be infected from the patient. So how do where to do the regowning? Regowning should be done in the corner of the isolation area, and where how please now do the regowning, and so that our audience can see. So from where first he has to remove his gown, and for removing his gown, now look on him. He is keeping his hand on behind, because if and keep the hand not in front, because if in from front you will regown, then there will be a problem, your hands will be infected. So he is regowning from behind. By doing this, he is regowning. Look on him how he is regowning. Now his hands are inside the gown, not outside the gown. If you are put your hand outside the gown, then your hand can be reinfected, you can be infected. Now look on me how he is regowning from the legs. So you use your legs movement to regown over this. After regowning the gown, then what next step you have to do? Then next step, what you have to do? You have to remove your goggle. Now he is removing his goggle from behind, because in from front goggle is infected. So now he has regowned the goggle. After that, he has to he has to open the he has to remove the gloves. Now don't put the hand over the gloves. Put your inside the backside, which gloves are very sterilized inside. Now please remove the gloves. By putting on this, he has removed the glove from one hand. He is removing the glove on other hand. Now gloves has gone. Gloves has gone inside, and on other hand inside. He is putting his finger inside. Now his hands are not infected. Now he has regowned all the things. Now remove the mask. How to remove the mask? You don't put the hand on your face. Many doctors, they are putting the mask all the time. They are moving the mask up and down. This is totally contraindicated. In this way, you are making yourself infected. Please protect yourself. So look on him how he has done the regowning and remasking. Now all these things, this should be done in the corner of the isolation room, where he has to put all the things in the closed space, inside the plastic bag. That should be wrapped, or that should be not at the upper end, and then this should be sent for the purpose of for the burning in the incinerator which is present in the hospital. Now, now we have learned that how to make gowning and degowning. Now, following these were the steps he has taken. Now I am discussing DOF, personal protective equipment in following order. Perform hand hygiene first, wear the gown, wear the gloves, perform hand hygiene, face shield, eye protection, and you have got a respirator, that is N95 respirator on your face. And in this way, these were the steps we have shown you how to. Now there is a big confusion. There is a big confusion. Every doctor in the fear they want to have all these equipment. No need. We can categorize the level 1, level 2, level 3 patients. In level 3 doctors are paramedics, are medics. Level 1, the person those are dealing in general OPDs, general emergency, pre-examination triage area of the coronavirus, or you are working in general wards or general OPD, then you need disposable surgical mask, you need disposable examination gloves, which we are routinely used in surgery. And before these things, you use the sanitizer or soap with water. And now I am washing. Suppose I am washing my hand. I am washing my hand. Put the hand in soap and wash your hand first in this way. Then put your finger inside in this way. Then clean your thumb in this way, and your thumb in this way. Put your fingers on the end and this way, and also watch your wrist. But please, before dealing with a corona patient, please remove your all the ladies and the lady doctors, lady workers, and even we male doctors, wristwatch, everything we should remove it. Otherwise, we can infect this and we can have a disease. So this is the level 1 people. They need this thing, so disposable surgical mask, and after doing this hand wash, and this hand wash should be at least for 20 seconds, because coronavirus is having the lipid layer and the cell wall. So if you will wash your hand with the soap, this is just like a lipid. When we are eating the oily things, then our hands become oily. How we remove the oil? We use the soap to remove the oil. So in the same way, if we will rub our hands for the 20 seconds, then the cell wall of the coronavirus will be destroyed and virus will be killed. So this is the easiest way. Sanitizer or alcoholic sanitizer are only good option when you have got no soap and no water facility, you are in traveling, you have to examine the then this is ideally after examination of every patient, you should wash your hands in routine, in emergency, in OPDs. Now level 2. What is the level 2? We have already defined that our corona patients are we are categorizing into two. One is the suspected case of corona, other is the confirmed case of corona. So suspected case of corona is this is level 2. When you are dealing with this, disposable cap, disposable surgical mask, disposable latex gloves, sensitizer or soap with water, wash your hand. So the people who are working in triage area, say triage center for corona, general ward, short stay area, then this is called the level 2, and level 2 people, they need this simple surgical mask is sufficient. Now let us see level 3. The level 3, the person, those are working, those are treating, those are dealing with the corona patients in the ICU setup, in the indoor patient, they should have a disposable caps, N95 mask, work uniform. Here the Tyvek suite is very important. Disposable latex gloves are very important. Goggles are important. Complete personal protective kit equipment should be available for these patients. So this should be weared by all the persons those are working in ICU, including doctors, consultants, including nursing staff, including ward attendant, including the sanitary worker, all these people. because they are human beings. If they will be ill, they will be sick, then we cannot compromise on the quality of healthcare workers, okay, including the doctors. So this was the checklist. Now there are some of the different facts and there are different discussion in throughout the world. And so what are the WHO myths and facts? The people, they are talking many things about the vaccine. Vaccine. Please, to have a new vaccine, there should be some, there are many trials, there are many phases of the trial. So up to now, there's no any vaccine is available for coronavirus. If your children are small, you want, because in the coronavirus patient there may be comorbidity, pneumonia, influenza. You can have a vaccine of pneumonia, influenza for those patients, but there's no vaccine for coronavirus. Please mind it, and hope whole world, whole researchers, they all researchers throughout the world, they are working over there. But we are unfortunately there's no any vaccine is available. Vaccine is the only prevention. Prevention is the only distancing. Distancing is only possible when you make yourself quarantine in your houses or in your in your homes. And please convey this message to everyone. Now, many people they are talking about garlic and the healthy food. Okay, we do agree. It is garlic is a healthy food and have antimicrobial property. But in this coronavirus, there is no any myth to use this extra garlic. If you are using your garlic in your food in different way, that is okay. But there is no myth. There is no any study or any evidence to use this garlic for this purpose. Now the people they are talking about there is no evidence that regularly rinsing the nose with saline. Many people they are washing their face. Doctors and paramedics they think that saline is good, so they can kill the bacteria. But of course they can wash the bacteria. But in virus, there's no any myth. There's no any fact to do the multiple time, put the saline in your nose. By doing this, you can injure your nose, and that is more prevalent to have a infection of the coronavirus from other contact. Okay, so avoid this thing. Now talking about the weather, many people say that this is cold weather, it happens in hot weather, it will never. So please, you can see many of the countries, Syria, many other hot countries, they have this corona infection. So this is not a logic. This is not a logic to that. We can suppose that we believe on God and we say that our weather is hot, we are sweaty, so this virus will be killed. So still it is not proved, and in spite of that, it is proved that in hot weather countries, this virus is the viral disease is over there. But another thing here I want to suggest that if you got don't use the extra cold water. Use the normal water or slightly warm water. If you have got unfortunately anything in your mouth, any bacteria, any pathogen, if you drink these by sip, your hot water or normal water, then your throat may be cleared, and these things will go into the stomach, and more than 60% alcoholic sanitizer are their swabs. So this is the myth. You can do this. Okay, thank you. I hope that you are not boring. You are listening me. This is because this is a hot topic. Talking about hot bath. Oh no, please. You can drink drink yourself the hot water or normal water, but by taking the extremely hot warm water, that can burn your skin, that can make another problem. So please, this is the myth. Talking about hot bath does not prevent the new coronavirus disease. Please mind it. These are the different things. Now, to date, there have been no information nor evidence to suggest that new coronavirus could be transmitted by mosquito. Because in this vector, this virus has been spread from the fish and meat and from animals initially. Now this virus is spreading from one person to other person. There's no any vector, just like in malaria, just like in dengue. There is no vector, so mosquito bite cannot transmit this virus from one person to other person. So please, only to you protect yourself, what to do? Clean your hands frequently with soap and water. If it is not available, then alcohol-based sanitizer, and avoid also contact with anyone who is coughing or sneezing. Here I want to clear, any person, any family which is living in their home, they have got a common flu, they have got no travel history, no contact with the coronavirus patient. Please don't be panicky. You have a common cold. Stay in your home. Because if you go to the hospital for the common cold, what they will give you? They will give you the Panadol. They will give you the paracetamol. You take the paracetamol in your house. Don't go to the hospital to buy the coronavirus in the hospital, because in hospitals, in spite of many sterilization procedures, there are many people. They may have this thing. You have last time seen that our many of our people, they are strongly working. Our one doctor has given his life. Other our people, they are taking care about this. They are shaking the hand with many people, so they have acquired the virus. So please don't get yourself. You don't get the virus from going outside to do this thing. For simple flu, be stay in your home. Ages. So okay, this virus cannot spare any age. But this is the question, the people who's having the other comorbidities. For example, having asthma, having COPD, patient is having uncontrolled diabetes, patient having the hypertension, which is taking the ARBs and ACE2 inhibitors, then they can have then the virus is, in these patients become more dangerous. So WHO advised the people of all ages to take all steps to protect themselves from viruses. For example, following good hand hygiene, and good respiratory hygiene. Please, you don't think that I am minor, I am young, I am healthy, I am athlete. Virus will not attack on me. So this is not. This virus can attack from the infant to the extreme age old people. And of course, the people who's having the other diseases, they are more in the danger. They become more critical. They will get the virus, but when the disease pattern with clinical feature, they will not have a mild disease, but will have a severe disease. For only those patients, we may need the respirator, we may need the ventilators, will need the ventilators in those patients. But for God's sake, in a country, if you count the ventilators throughout the country, then how many number of these are in the thousands, not in lakhs. So if this virus will become a pandemic in our country, just like Italy, then we cannot face this problem. Please, what you have to do, you have not to spend any money. You have to stay in your home, and you have to do the hand hygiene with common soap, which is easily available. We don't recommend any soap. Many people, they are using the Dettol soap. You know, Dettol soap can damage your skin by multiple times if you are using. So please use the common soap, if including from Lifebuoy to anyone. Don't go over the perfume soaps, and use the common soaps. And सिंधी में चवंदा आहिनि खार खार जैसा कपड़ा पाण धोईंदा आहियूं, सिंधी में खार बोलते हैं, जिससे हम फर्श और घर के चीजें साफ करते हैं, उसका भी अगर 3% सोल्यूशन बना के, इफ यू मेक ए सोल्यूशन ऑफ दैट 3% सोल्यूशन, इफ यू वॉश योर होल हाउस, होल योर रूम, दिस इज आइडियल. You have not to you have not to spend extra money. But when you will become a disease, then you yourself, the government, all the resources, they will spend a lot of the money on this management, and we don't know what will be the outcome. But thanks to Almighty Allah, in Pakistan, there is an international study shows that 98% people, they survive, 2 to 3% they die. But in the Pakistan, the virulency of this virus is less, because in the Sakhar, the most of the people, they have the virus positive, but their tests were negative even after the 14 days. So this is less virulent, and patient having no symptom. So this is a good thing. We hope for this, but we should not be very happy that we should get it. We should not get it. This is ideal. This is very important message I want to give you, because this new virus, we don't know. how if this virus will create the symptom in all patients or not. Our this recent data shows from the Sakkar quarantine areas and isolation ward, the patient having the test positive, they have transmitted the disease from one to other, but they have no symptom. So please, if there is any travel history, no symptom, even then that person should keep himself herself quarantine. And this is the high time. If we will keep ourselves 14 days quarantine in our own houses and homes, then we can break this chain. Mind it. Why we are stressing on this point? This virus age is 14 days maximum. Suppose this virus in one body and that person is separate. After 14 days, he or she will be himself or herself well, because virus is self-limiting, and other people will be not infected. So virus will die over there. So that's why we are stressing that at least 2 weeks quarantine throughout the country, throughout the provinces is very important. Unfortunately, I am delayed to deliver you this lecture for 40 minutes. I have started my, you see the I left my house half an hour earlier, but I am delayed because there are many people. They are in cars, they are on the road, they are at the rush, the police and army and ranger. They are inquiring from these people. So ask them, people, please. We all doctors and paramedics. We are here in the hospital for you people. We have left our families. We have left our beloved. We are working for your health. So please, for God's sake, you remain in your house for our lives. If you will not do this, then we cannot face this problem. And our so this was about this myth. Use of antibiotics. There are many antibiotics used. There is no any proper study. People they are talking about azithromycin. People they are talking about the chloroquine. People they are talking about the use the HIV drugs, prevention drugs. But there's no at present in Pakistan. There's no any consensus. There's no any study that we don't recommend any antibiotic or anything to these patients. So please avoid this, because if the age is old, patient is cardiac, hypertensive, patient is taking chloroquine, azithromycin, it can prolong the QT interval. So it should not be used. But we, all Pakistani physicians, senior physicians, we are sitting together. We will sit together. We are making some guidelines. And if the patient who are very serious, these drugs are not for prevention. Please, for God's sake, these drugs are not prevention. For prevention, don't use these drugs. But in the ICU patient, when they become very critical, then some of the studies, international study shows there are some of the, you see the results of these drugs. कहते हैं ना कि मरते को बचाने के लिए आखिरी हर्बा भी इस्तेमाल करना चाहिए. जब पेशेंट वेंटिलेटर पे होगा, पेशेंट विल बी वेरी क्रिटिकल, then we might think about these antibiotics. But this will be used in ICU setup under the supervision, under the vigilance of high level people. Now, to date, there is no any specific medication recommended to prevent or treat the new coronavirus. Okay, there's no. There are many studies that are going on. However, those infected virus should receive appropriate care to relieve and treat symptoms. Those with severe illness should be received optimum supportive care, only supportive care. Some specific treatment are under investigation and will be tested through clinical trial. WHO is helping to accelerate research and development efforts with a range of partners. Okay, so we should wait for that. And thermal scanner are now one thing. I have written from the UK. On the airport, the people they have scanned me, the thermal scanner. Thermal scanner only tells your body temperature. Thermal scanner is not screening to test to rule out your virus. So when you will be, if you will be symptomatic, if the person having the symptoms, patient having the temperature, thermal scanner is detecting only the temperature. But every foreign traveler person should cooperate with the government, with the health delivery system. However, they cannot detect people who are infected but are not yet sick with a fever. This is because of it takes between 2 to 10 days. Usually 2 to 10 days are required after entering of the virus in a person to become asymptomatic. But unfortunately, in our country, in Sakkar, The 14 days are finished. Many of the people, they have got a virus inside, but they have not developed the fever. So please make yourself quarantine in your houses. Please, 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 for the sake of our nation. No hand dryers. People, they are drying their hand in hand dryers. This is useful. This is not useful. This is useless. This can dry your hands, but this cannot kill the virus. Okay. So this is important message. May people, they think the ultraviolet lamp should be used to sterilize the hand, because some of the ultraviolet rays, they can kill some of the bacteria, some of the viruses. But this coronavirus cannot be killed by these ultraviolet rays. Don't use these lamps. Don't do, and many of the people, I have, unfortunately, they are marketing these ultraviolet lamps to sell out. Please don't purchase. Please don't purchase. And the people who are seller, please don't sell these. Don't make our population, our nation panicky. Don't make our population panicky. So another thing, spraying alcohol or chlorine all over the body. Some people, you have seen in some of the country, many of the people, they died. They have taken the spirit, they have taken the alcohol orally, and they have taken some other things. So to make themselves because if you use the alcohol in mouth, in nose, in chlorine for disinfection, then the oral mucosa, the mucous membrane of the nose, oral cavity, this will be traumatized. Then you will be more prone to accept coronavirus as well as the other bacterial infection, because in your mouth, in your nose, the normal flora is there. They will become opportunist. They will infect you if you are diabetic, if your immune power is less. So don't believe on this. So far that evidence, new coronavirus can be transmitted in all areas, including areas with hard and humidity. Suppose we say in Karachi there is humidity, in the Tharpaka, in the desert area, there is a very hot area. So this is not a myth. So please, regardless of the climate, adopt protective measures. If you live in or travel to an area reporting coronavirus 19, the best way to protect yourself against coronavirus by frequently cleaning your hands, eliminate virus that may be on your hands, avoid infection that could occur by then touching your eyes, mouth, nose. So this is clear message. I've repeated this message again and again because there's no any other way. Thank you very much. Thank you very much. And now the questions by audience. What are the supportive for the GPs? Okay. One question from one general practitioner. What is your supportive for the GP? The general practitioner, for general practitioner, I advise you should wear the gloves, you should wear the surgical mask, you should take care of their hand wash, and in your clinic make two portions. One is the fever clinic. Any person who is having the fever, examine those patients with if you have got a N95 mask available, okay, or examine those patients with the distance. Examine those patients with the distance by keeping the distance of the 1 meter. Don't touch them before. And suppose that give the travel history and all other, use the simple stethoscope and simple sphygmomanometer, because suppose that patient is a coronavirus positive or suspected, you have to burn out your state. So please make your fever clinic separate, make your travel history clinic separate. So this is for GPs. How we can improve the immunity? Okay, very good question. The immunity can be improved with a natural way. Nature says that you should take the good rest. You should take the good rest. People, they are sitting in the houses all the time. They are awaking, watching the television, watching the dramas, and they are all making themselves tired. Don't make yourself tired. Take the maximum rest, maximum sleep, not by pills, by your own natural. Take vegetables, take fruits. Fruits, they contain a lot of the, you see, they will boost up your immunity. And if you are diabetic, then control your diabetes. That also will increase your the immunity in diabetic. Now, what is the role of vitamin C? You know, vitamin C. If you see if you measure the vitamin D in the population, most of the people, they are deficient in vitamin D. They are iron deficient. There are other things. Of course, vitamin C is good antioxidant, but If you take the extra vitamin D, then there is no hypervitaminosis, but there will be the gut problem because it is acidic. You will disturb your tummy, you will disturb your stomach. So there's no any clear cut role. Do normal saline can make prevent infection? I've already explained you. Normal saline cannot make you free from this virus. It can be used to sterilize yourself from the bacteria, but other pathogens, not the virus. What is the clinic? And PPE, we don't know. The coming patient is suspected or corona confirmed case. Okay, you ask from distance at your clinic the travel history, the contact history, fever history, and symptoms. If there is any travel history, contact history, then there is a symptom of the fever with the travel history, then it is a strong suspect case, then that is your case. Then you take all the measures. Then you should wear the personal protective equipment. But if there's no travel history, there's no contact history, suppose in that house nobody has gone anywhere, and then there's no fear. What is the truth about the hydrochloroquine? I've already told you the hydrochloroquine, chloroquine, the azithromycin, other you see the other some of the HIV drugs. These drugs has been used in some of the trials. One of the study I was reading from France, there are only 90 patient study. In China, in India, there was 3 patient study. So we don't know the natural immunity has protected that person from the disease or this drug. So the large number of the, there's a sample size for any research. There's a clinical trial should be conducted with the proper sample size. So whole WHO and whole world is running on this. Suppose anything which is if any there, then we will do. Hantavirus, and this is another news on the media, social media, that in China there's hantavirus which will come from other animal. So at present there is no any case which is there, but this is the, you see, this may be something we don't know. I cannot claim, I cannot say, but at present, please don't worry. There's no hantavirus even in the China. So there are many misconceptions. There's many rumors. Please don't go on the rumors. Follow these guidelines. If you need anything, if you want to know more for your public awareness programs, you can look on the Facebook. There are LUMS, LUMHS, LUMS FM radio 96.6 Facebook page. Please listen again and note it. LUMS, LUMHS. One LUMS is Lahore, in which there is no H. In our LUMS, this is a Health Sciences University, so there is H. LUMHS, LUMS FM radio with a frequency of 96.6. The Facebook page is available. Our consultant of the public health, we ourselves, we are updating you regarding all the things. We have made some video, and those videos are present over there, and you can see this. Thank you very much. Thank you very much for the patiently listening, and give you a message to all you from my side. A message to you: don't be fearful, don't be panicky, be strong. We Pakistani people are strong. We can face any war, anything. So this is war with the virus, coronavirus. We will win it. Make yourself stronger and follow these guidelines how to protect yourself. If you follow these guidelines, then we will defeat this virus, this pandemic in Pakistan. We will face this. Pakistan Zindabad. Thank you very much for listening me. Pakistan Zindabad.